Since it's we're going to get started since it's 3 o'clock, and welcome everybody. It's June. It's the second day of June, and where did May go? And the rest of it, like normal, it just flies right by. You don't keep your eyes open, you're gonna miss life. So, but welcome. Thanks for everybody coming down and really taking time out to be able to do what we do here. So. Any other introductions? I think we don't have any. And it looks like we've all been here enough that we don't have to go around the horn and say who we are this time. Maybe we'll get new people. We will again. So I guess our first item up is just the agenda, and as you see in front of you, the agenda, and more time needed to read over it or have any questions about it. Probably a pretty light agenda, I believe it will be. So
yes, sir.
So, okay, then if we'll have a motion to accept the agenda as it has written.
Motion to accept.
See Commissioner and all right, and all in favor? Any opposed? Thank you very much. We have any for the public comments?
Belinda, we did not receive anyone for a public. Sir.
All right, then we'll move on to item 4, which is our consent agenda, and any discussion over what was emailed to us in our consent agenda? Need a motion for that too. And second. And all in favor? Any opposed? All right, Mr. Kessler, do you have anything from the board?
Nothing earth shaking at this time.
Well, we appreciate it, and as usual, we appreciate you being on board with us. All right, then we'll move on to item 6, Director's Report. Lynn?
All righty, I am not without shattering news, so I do have some things to report to the board. Great to see everybody. Wonderful time of year, starting to get warm, and so glad that we're all here together and could make it today. Some big changes that we're experiencing in the county. Tim Manis, y'all may or may not know him. He's the budget officer, and he's been with the county about 20 years. I'm sorry, he was the budget officer. Now Tim Manis is the new assistant county manager, and that is very new. He's been in that role for a couple weeks now. They have not replaced his budget officer role yet. And Corinne, I believe we're still talking to Tim about budget stuff if we need anything. So he's quite busy with getting us across the finish line with our budget, which Corinne will speak about in a little bit. Casey Smith also has submitted his resignation. So our county manager will be leaving in the middle of July. It's my understanding we'll have an interim county manager until the new Board of Commissioners is set, and then they anticipate seeking candidates then. Is that correct?
Correct.
Okay, great. So we will be trudging along. This week, we are saying goodbye to most of our school nurses. They are going to take the summer break off. I'm incredibly envious of them. I just told somebody this morning, I was like, I love public health and I love summer. And if I had to do it over again and I could manage needles and blood, I would probably come back as a school nurse because this seems like a really cool gig to be able to get the summertime off.
Hey, we have a need for that. It's never too late, Lillian.
I could come right back and I don't know how we can't get more people to do it because I would love to have the summers off, but we're trying. So then we are recruiting. Speaking of recruiting, we have a PHN1 for the clinic that we're looking for. We have a new nutritionist that'll be starting at the end of the month. So now we're only recruiting for one nutritionist. We have a care management person that will be starting at the end of the month, and we're still recruiting for one other with that. We're holding on our health educator position, but that will be posted very soon. And our business office will start posting positions soon. And we're holding on school health. Like Justin just said, we do have a need for that, but in our new budget, there is a new school nurse position. And so when Mary Lou and I spoke with Kristen Beanblossom, our school nurse supervisor, she said it'd be great if we're going to be potentially recruiting for 2 to just go ahead and recruit for 2 with the workday system. So after July 1st, we'll open 2 PHN 2 positions. One will be a temporary one with that short-term funding we had, and the other would be the full-time one that was put into the budget this year. Speaking of Tim, the budget guy, he gave me a call and said, y'all saved a ton of money this year at the health department. And I was like, I know, because we're awesome. And he just laughed at me. But really, the real reason, honestly, y'all, is because we have a lot of staff vacancies. And so while it's great, we love to save money, we really do, but it is a lot of hard work trying to fill in the work of vacant positions. And our school health team, our social work team, our billing and business office has been really working hard to do the work of those vacant positions. So we're quite hopeful that our new budget year, we can get positions filled, but it's always nice to save money for the county. After July 1st, we'll report back to y'all on what the end of year savings really look like, but we have not closed those books yet. Oop, went a little fast there. So, y'all may remember some time ago, we had an in-depth discussion about our rabies clinics and how we were providing them here. And y'all talked to me about it and told me that y'all didn't really think people were going to be out in the streets screaming if we didn't do a rabies clinic. And it turns out most other counties are supporting advertisement for rabies vaccine clinics that their shelters are doing. So last weekend, the Davidson County Animal Shelter did a vaccine event and a microchip event. Jana shared that on social media, and we're checking the box for meeting our low cost. We will continue to keep our eyes and ears open if there's a need in our community that people are unable to get rabies vaccines. But as it stands right now, we were able to save a lot of county dollars by not putting that clinic on ourselves, and the need is being met in other ways. So if y'all as board members hear anything about issues with folks getting access to rabies vaccines, please let me know and we can revisit this. But it was a significant cost savings for us to not have to set that up on a Saturday. Yes, sir.
Is the cost associated with that? You just have to purchase the lots of vaccines at a time, or what?
The people work in the clinic. Yep. Overtime. So you're at time and a half when you're doing that kind of work. And so it would be a significant cost for us to do it. And
Makes sense.
Yeah. So actually the folks pay for it. Now, a couple of years we were able to do it at absolutely no cost because we had one-time CD funding and we utilized that to do the rabies vaccines for free. But we partnered with a local veterinarian and he would actually take the fees and that would go to pay for the vaccines, and he brought some staff too. But we were upfront with our resources of being time for the folks. Thank you. Yes, sir. Stacy and her team rocked pool season this year, but the last couple of days before Memorial Day, they were running like crazy all over the county for folks who had had pool problems and needed second visits. But all the pools that needed to get open got open, and things were wonderful. I think the weather made a turn, so a lot of pools were able to open and operate on Memorial Day with permits from our health department. So that was great. Randy's team has gotten everyone through the FAA portion of the training for the drones. So we're excited that soon all the staff members will be able to use drones, and we'll be able to include drone photos in with people's septic applications and septic permits. And that's just a really nice feature to have. Yes, sir.
I just want to know, what kind of trouble is it to get drone license, to become not the whole training maybe, but just the licensure process?
To get a Part 107 license is, you can just go take the test right now. You don't need any training, but you might want to do a little reading beforehand. We chose to participate in the emergency type management training course, so it didn't cost anything to send staff to other than travel. But it's a 4-day course where they go through the ups and downs, ins and outs of remote pilot licenses, which is similar to a regular pilot, I've been told. I don't have a pilot's license, but and then after that, you just go sit at a testing center, and you take the federal exam there.
And probably above and beyond what we will ever need, but is there almost like a pilots, like twin engine and different sizes of drones as you matriculate through the licensure process for other?
It is currently the way we have it set up. It's under 55 pounds. You can operate without a waiver. So there's other kind of, like any kind of government, federal stuff. There's hoops you have to jump through if you want to fly bigger, fatter, stronger drones.
Oh, thank you. That was for my information mostly. Thank you.
We're coming up on accreditation, and it feels like a long time ago that we did that, but that is when we gather all the documents and all the work since the last accreditation site visit, and we have to submit all that to the accreditation team by the end of this month. And then they will let us know if they're missing any documents, and we'll have a couple of weeks to provide those documents back in there, and then the site visitors will come. So as it stands right now, we are incredibly busy trying to make sure we have all of our I's dotted and T's crossed, because as I'm sure y'all remember, if we do not receive our accreditation, we are at risk of losing funding. So we really want to make sure that we get that taken care of. You know, it feels like a broken record sometimes with new laws and rules and regulations that we're told you have to do this by this time. So we were told that the ADA had set this date that you had to be ADA compliant on all your websites, on all of your patient portals and things like that. So we scrambled really hard to work with our EMR to make sure that our patient portal was ADA compliant. And what this is a visual thing for individuals who may have more difficulty reading and things like that. And so we had to make some changes to it. We got it done, check. We engaged with the IT department, with the county, because we were like, we've done our EMR, but we don't know how to do the website. And we're emailing feverishly with them back and forth, like, we have to do this, we have to do this. And then they pushed it, out, 2 years? Yeah, something like that. So we got everybody all up in a tizzy to get that taken care of, and we've got 2 more years. But the county IT team is working on the part for to be compliant on the website. But we do have our EMR done, so we can check that box ahead of schedule. The world has gone to social media, and so this year we tried a new way to advertise our WIC department. It is a requirement for our AA that we do at least 1 advertisement each year. When I first started, I think we advertised in the Dispatch, then we started in the Orator, but this year Michelle and Jana worked together to do Facebook, and Jana's able to see how many connections we had. Michelle's team was able to tally folks that came in based on seeing it. Do y'all want to speak on how that worked out for y'all?
We had a increase in our initial certifications, which are first-time clients, so that was really great. Jana was able to see exactly how many people had seen the ad and then visited our page. So we gained a lot of followers from that. The biggest takeaway was just that we had a lot of new clients and a lot of pregnant moms who seem to not know that they're eligible for WIC. So that was really wonderful. So we've got we've seen a good increase in participation from it. So
I'll say from my perspective, and as have been the WIC director formerly, it was so much easier to do it this way. And I knew that the visibility was there for Michelle and her team, whereas, you used to just hope that somebody would read the newspaper that day. But it was a lot easier, and a little bit of money went a lot farther with digital ads. So
We're getting there, y'all. 1 step at a time. And a picture's worth 1,000 words. So on the left here, we see Michelle with Jennifer Bailey from the state WIC agency. Last week, Michelle was able to go to Texas to present about the great work that we are doing with our Baby Cafe partnership. Michelle, I'm hearing from other health directors in the state of North Carolina. I'm hearing from the state of North Carolina just how wonderful our program in Davidson County is. We're seeing an increased utilization of breastfeeding, which is, we've talked about this a lot, so important, and we are just thrilled. So Jennifer came and found Michelle after the presentation. She was like, I'm from North Carolina, you did a great job. And what'd you say? There were like 200 people in the room? Yeah. People sitting on the floor for your presentation. And so I just could not be more excited for Michelle's hard work actually coming to fruition in this national recognition that she's getting. So we're really proud, and she's making Davidson County look great across the United States. In Texas.
Texas, okay.
Mhm.
Awesome.
Yep. And then on the right are one of the 2 new Colorado trucks that we got for the environmental health on-site wastewater team. We replaced a Jeep Liberty that I think was a 2012 model, and a rental that was replaced with I say rental, that's the wrong word, a borrow from the garage that was replaced by another borrow from the garage. So these are some two very needed and much better upgrades to get folks out in the county in. So Randy's team is able to utilize these trucks. And so we are very excited to have those. So that was my report. If there's any feedback, happy to.
Thank you very much. Any questions for Lillian? I have one.
So
Pool inspections, what's the thing that usually fails most? What kind of criteria? I'm just curious.
Usually I think it's the phones. I don't know why that's always a thing, because it's really out of their control sometimes. It's like something just go wrong, or a lot of times they don't want to pay for the service when it's not in pool season. So that's usually, for whatever reason, is what fails them the most, but everything else is pretty easy to fix. Like, you can change the chemicals, you can cut the rope or add a sign. Those are usually easier things to fix.
Wouldn't have thought that. Okay. Thank you.
You're welcome.
Anything else? Okay. We have a bit of old business. I'm not sure who's presenting this.
this will be Corinne.
Okay, all right, for the budget. I thought so, but.
I did share this image last time, and I'm realizing now it's probably a little offensive to county management that has so much to do with the budget that I put 4 little you're here bullets. We're kind of in the middle point of our new budget that will start July 1st. The county manager has presented it to the Board of Health. They've put out the public hearing for the last meeting to come and make comments about what was presented. Looking through the packet of information, we don't really have line by line what we've requested and what will be approved. But everything seemed to be in there. Our new positions are listed. The 2.5% and $500 cost of living increase for staff is included. So the next meeting, which is Thursday, Commissioner Custer will get to look through and do a work session on the budget a little more that day. So we're still just waiting for Christmas in July, that we like to call it. July 1, we'll kind of know what we're working with for the next year.
We have high hopes.
Thank you, Corinne. Anything for Corinne? All right. Thank you very much. Well, with new business, the next presenter is the greatest speaker in the world. So maybe about 3 meetings ago, we had an idea to bring to the health director. Chairman, topics that were just maybe separate from anything. We're doing real well, so no one had any pressing topics. So I made up one. Actually, I did not make up one. I had one that I thought of myself, and I thought, well, I'd like to bring it and discuss it and see. And so the meeting structure and procedures. Now, I don't get to a lot of them, Commissioner, but I have been to a few of the County Board of Commissioners meetings and a few others. And I realized that the beginning of meetings are quite often very uniform, with a couple events. Two of them being the opening Pledge of Allegiance to the flag, and then perhaps a quick invocation, a prayer to bless it. So today I didn't want to really bring this to a meeting, but I want to discuss it and see if that is anything that the board members and even staff to input on that. I realize a couple of things we'd have to have, probably a flag. We'd need a flag, and we'd also need the stands for it and stuff, and it maybe stay in here or possibly moving around the different locations. So I'd like to open that up. Is that anything that would be of interest that we could possibly take to the next meeting and vote on it? With that?
It is.
Yeah, I thought it would be, in keeping with, our duty on this board with the, constitutional and the state and the county's bylaws, it would be a good idea. So I guess maybe then what we might need to do is find out maybe a cost of.
Already done that.
I figured you did. That's why I had to let you know first. So is it some
I did
Something you
look
could
into
bring up,
them,
yeah.
yes, and I can bring that to y'all, but approximately, if we wanted to go with a North Carolina flag and a United States flag in a stand, you're looking at about $300. That is most certainly not the most top of the line one, but our ceilings here aren't very tall either, and so we would not need to get like the biggest ones that they had. So you're looking at shipping and everything under $300 for North Carolina and for both.
Okay.
Yes, sir.
Yeah. That include the
The stands.
stands and everything.
Yes,
Okay,
sir.
all right, yeah, clearly, not a horrible, and where would we appropriate that from?
Oh, we have a supply
Okay,
line at the
okay.
health department for
Alright,
supplies in
okay.
the building, if y'all wanted to do that.
Want to make sure we didn't bring that out of something that was not, shouldn't be, so. Okay, all right. Well, like I said, I I didn't want to necessarily throw it on the spot and have everybody just immediately talk about it, but if that is amicable, take it home with you, think about it, and then maybe we can have a discussion and a motion on to doing it at our next meeting, which will be August, right? I believe.
Yes, sir,
Yeah.
August 4th.
Well, thanks for letting me bring that up. I thought it was very important.
Thank you for bringing it up.
Well, good. All right, then we will move on to second one, which is a spotlight on some community health. I think that's one of our board members also gets to bring that up.
Yes, and if you don't mind, I'd like to introduce Crystal Swank. Seen her before. I don't mean to tell too much information, but she and Justin, I think, spend Christmases together, right? Their family. So, the Davidson County way of doing things. That's what we love about Davidson County. We have so many wonderful friendships, family relationships, and colleagues and things. And Crystal is one of our team members that has really, in the last 3 months, increased her workload. And that's what she's here to talk about today. Crystal is bringing to light a vision that Mary Lou Collett has had for a long time. And Mary Lou and I talked about it, and we were trying to figure out a way for our team to really do more impactful work for people in our community in a less traditional way. And the way that we've done that is with an innovative leader like Crystal Swink, who is not only leading and molding staff members, but she's doing the work herself. So I don't want to take away too much of what Crystal's presentation is, but I want y'all to know y'all are speaking to a public health rock star right now, and hearing from her when she goes through this. Her calendar, every time I talk to her, I get tired looking at it. And Belinda jokes on my calendar about getting tired of looking at mine, but Crystal's is way crazier than mine. They're all over Davidson County doing this work, and I'm just so excited about it, if you can't tell. So, Crystal, I'm sorry to take your time.
No, you're good. You're
I
good.
apologize. That means a board member, or staff member.
Okay, no problem. No problem. So I'm Crystal Swink. I am the supervisor for the community health team. So that encompasses some community health social workers, public health planner. I also supervise our care management teams as well. So we have been at this for a little bit of time now, and it's really starting to boom and blossom. And what we're out here trying to do is just get out in the community, spend a lot of time talking to people, educating people, sharing nursing knowledge, sharing general knowledge with the community itself. So, really trying to encompass the whole entire community, what their needs may be. We've got some health education programs that we're doing. We're also doing some supportive services. We're even now branching into some wellness workshops, which is really nice to get that far. We're trying to empower the residents here in Davidson County to make informed decisions about their health care, and their overall health. So, of course, me, I'm the supervisor for the program. We have Leslie Diaz. She goes by Leslie Diaz. She's our public health planner. And then we have Sherilyn Little, who's our community health social worker. She's been here for some time. So that's been really pivotal in, moving this forward. We also have Tina Coltrane, which is our other community health social worker. So some of the things that we're doing currently, we're going out and providing some health education presentations, some chronic disease education and prevention, wellness presentations. We like to share other services that are provided within the health department. We're doing community case management as well, some parenting classes through Triple P.
I'm still going out and doing postpartum newborn home visits. We're also promoting car safety, doing some tobacco and vaping education, safe sleep education. We're doing some medication administration training, and then we're also trying to participate in as many community health fairs and events as we can. Right now we're getting out, we're providing a lot of health education presentations, and each one of those are tailored to the different population that we're serving at the time. It started with our senior services here in Davidson County, going out to their what they call congregate sites. And it's just kind of went from there. So what we're currently serving right now, we're at the Tom A. Finch YMCA doing some active adult classes with their senior population. We're in the process of formulating some presentations for the J. Smith Young YMCA here in Lexington. We're continuing our work with Davidson County Senior Services, so we go to all of the nutrition sites. But we've also been doing some specialty type presentations with them as well. RHA, that's early recovery, if you guys are not familiar with that. We've been going out and doing some wellness presentations with them, which has been really beneficial and really a good audience. So tomorrow is my first presentation with First Hope Ministries. I'm going to be speaking to the general population about diabetes tomorrow. And we're also planning to do a cancer services support group.
I will say I'm going to jump in. Senior services group, they fight over Crystal. They fight over who's coming, what's she going to talk about? I want her to talk about this. No, I want her to talk about this. So they present topics from falls to, oh goodness, they've had some interesting topics that they've wanted us to bring to them, but they have loved our presentations there, and Crystal goes, and they look forward to her coming every time. They've written notes to say, why wasn't she here? You know, and that kind of thing. So yeah. It's been great.
Yeah, it has been a lot of fun. We really try with those topics to at least address immunizations yearly, falls yearly. We also talk about like summer safety and making sure these seniors are out here staying hydrated and cool and not working too hard. And we're sharing resources we know about with them too. So it's been really nice. We've really enjoyed it. And we're also, out here doing some wellness presentations. So we're trying to, integrate some mindfulness practices. We talk about journaling. We talk about all kinds of things, to help them achieve their wellness goals. We're currently serving RHA. We also do some wellness things with Davidson County Senior Services. We do have the Bridges, which is a program through the ARC of Davidson County. They come here monthly. We talk to that clientele about all kinds of things, from hygiene to eating healthy to exercising. That's a lot of fun. And we're getting ready to do the J. Smith Young YMCA here in Lexington. They've invited us to come and talk to their summer camp and their kids business program. So that pretty much covers the ages from 2 to 18. So several years ago, we implemented community case management within the clinic. So we've been going up on Friday mornings. Sometimes that's our busiest day. That's our STD walk-in clinic. And we go up there as needed too. What we're doing up there is just kind of identifying any needs that person may have. They may be here for one in particular thing, but they may have some other things going on: housing, food insecurity, any of those things that are listed up there. So we try to address all of those and make sure we share resources that we know about with those people. We also work with people that come in here needing specific things. I normally I'm right by the front desk, behind the locked door. I try to pay attention to what people say when they come in, so that, we've identified a lot of people that could have been connected to WIC, could have been connected to, some food banks here. Maybe they didn't know how to apply for Medicaid. So those are all the things that we're trying to do, is just make sure people know their resources and then set up a plan with them, follow up and see how things are going. So. This is really booming right now, which is our Triple P parenting classes. We do have 2 accredited Triple P providers. There are different levels of Triple P. We are currently doing Triple P seminars for children. So that's for parents with children 0 to 12. We're also doing the seminar for teens, which is for parents with children that are 13 and 17. I will tell you, having a 14-year-old, that is a really good program and very helpful. So we are also doing Triple P Baby. That's our newest accreditation. That is for new and expectant moms. So we can start working with the clients when they're 20 weeks gestation up to that baby's first year. And that's a lot of focusing on mom and her needs and the family dynamics and the family's needs. So that's been a really good program too. We also provide individual sessions if parents have specific concerns that they're maybe not comfortable talking about in the group setting. And we have discussion groups for common parenting problems. Right now, we're doing that pretty much every Thursday. We have 2 different classes running, but we're getting out in the community now. We're offering Triple Baby at Thomasville Housing Authority. And we're working with Head Start right now. Tomorrow is our first day going to Head Start to have a Triple P group. So,
what do the 3 Ps stand for?
It's positive parenting. Yeah.
Okay, positive.
Prevention. Yeah, positive parenting and prevention. Yeah.
Okay.
Yes.
And Crystal too, can you talk a little bit about how the Triple P class may be assigned to some people and how that's a healthy partnership with our DSS?
Yeah. So we've been working with Davidson County Foster Care and CPS. That has been something they've kind of implemented too when they're working, if they've assumed custody of their children, that may be part of that family's plan to get children back into their custody. Might be something that they're working towards. So they do have to attend those classes. It's been really helpful. I've sat in on a lot of them with these parents that either don't have their children or in a position that they could potentially lose their children, and giving them some more positive skills and positive ways to work with the children that they're in jeopardy of potentially losing. So it's been really good. It's really nice when we have voluntary parents that come in here that want to do this. But we've seen that it's been really beneficial with the parents that are working with foster care currently. It's a really open group. It's very positive. Everybody has to be respectful. I will say Shirley Little runs that like a well-oiled machine. Like, you better come here prepared, wearing clothes that you should be wearing. She expects them to be respectful to each other. And there's some really good discussions that come out of it. So
another thing we've seen with that program is sometimes we've had grandparents and parents come. So if you have a support system and both of them are coming to support each other, that's helpful. But we've had one particular time we've had some that maybe didn't have transportation. Well, this one did. And then they kind of communicate and get a buddy system a little bit. That way nobody's missing anything. We've had that. That's been kind of positive. And Sherlin's kind of navigated that a little bit because you don't want to put anybody at risk either. So that's been positive, and there's been some kind of lasting connections there that Sherlin has kept up with that. And I will tell you, with some of this stuff, my vision was, boy, I'd love to have a program that's not tied to, you got to be pregnant, you got to be a child. Our programs here, you have to be an income of this, you got to be 5 and under, you got to be I was like, Lillian, before I leave this place, I want 0 to 99, maybe 100, since we're living a little bit longer now, that anybody walks in, we can help them. We can do something if they come in. This has been that program. COVID hit and it fell flat. And I was like, oh my goodness, we're not going to be able to do it. But this has been a good year for it. And we have had folks that literally have walked in the door. We've had someone living in a tent. We've connected him, I think, back to some family members that, but had we not had this, he wasn't pregnant, he wasn't this, he wasn't this, we wouldn't have anybody to help him other than to say, well, maybe you can go across the street and see what you can qualify for. But we helped with that and we didn't lose that person. And that was a success. One success is one success, and that's great. But that's kind of our vision for this. I'm getting on a tangent, but anyway, that's kind of where we're going with these positions, where hopefully we'll be able to help anybody that walks in versus having to be tied into a program. Sorry, Crystal.
No, you're good. One of the other things that we can do as well is Leslie Diaz. She is certified with the Child Passenger Safety, which is a nationwide program, but she's a technician here for Davidson County, so she has the ability to do that comprehensive car seat check. We do those by appointment because those can be a little lengthy. We don't want anybody out here at 12 o'clock, right, when it's 90 degrees outside, trying to install a car seat, and it takes a little bit of time because we're looking for recalls. We're looking for any expiration dates on the car seat. If you're not aware, car seats expire. So that is very important for us to make sure that it's not an expired car seat. And we're also looking for any damage that we can see. She does a good job educating parents on the appropriate car seat based on the child's height and weight. Age always varies depending on their growth. You may have a really tall 2-year-old, and then you may have a little short 2-year-old that needs to be in a smaller car seat. So, and she provides tips on best practices for car seat safety. So that has been a really good program to have here too. Postpartum newborn home visits. This has been around way before I was even here, for many, many years. They are offered to any Davidson County resident that has active Medicaid. They have to be within 60 days postpartum. I go out, I do a comprehensive visit with the mom and the baby, try to provide that extra support. It's a lot of education. I try to get out to see our new moms who have, any kind of substance use disorder, anything like that. Moms who have had traumatic childhoods, whatever the case may be. I try to get out and really educate on routine infant care, home safety, car seat safety, safe sleep for baby. We know that that's been an issue with child fatality in the past. So we're real big advocates on making sure that, they have a safe place for their child to sleep. We talk about postpartum depression, which has always been a concern, but it's more so a rising concern these days. I also educate on contraception and everything that's available out there. Make sure that I link those people to any resources and referrals that they need, and then follow up as needed. So, this is another service that I provide as well. So we have several different agencies here in Davidson County that do hire unlicensed assistive personnel that do provide medications that may be like in a group home setting. So I go out and do a training before they're able to give out any kind of medications. We talk about the legal responsibilities of giving medications and making sure that they're complying with the policies of the agency that they're working for. I do a lot of education on the 6 rights of medication administration. We go over some detailed instruction on each of those rights. We talk about accurate and precise documentation, infection prevention, so a lot of hand washing, things like that. And then making sure that these people are also fostering the independence of these residents in the group home and protecting their privacy. And then we're out doing a lot of outreach events right now, which is a lot of fun. We do collaborate with a lot of our local agencies, schools, churches, other community partners. Pretty much if anybody in the community calls me and says, hey, I'm having a health fair this weekend, we're going to try to make a way for somebody to be present and, provide our information. we really focus during these events, building and strengthening those connections that we have, supporting the community, and really just getting out there and educating the community about all the services here at the health department. That's all I have. Any questions?
Well, thank you very much.
You're welcome.
Very good presentation. Appreciate that information. All right, well, we'll move on to our next topic, which have we been following rules?
We have been following rules. Y'all may remember, you are the local board of health, which means you are a local rulemaking authority. Y'all oversee 3 sets of rules here in Davidson County. The mobile home park rules, they have been around since, I think Mary Lou has the distinction of the only person in the room that was here when those were effective. And then the rules for the control of rabies, those had been around for some time, but in November of 2016, we updated them to follow the national rules. And then the recreational water facilities rules, those are unique to Davidson County. There's nothing like them anywhere else. We are the only county in North Carolina. The state was almost, I mean, Randy, I would say zero help, but they weren't much help at all when we were doing this, were they?
No, we got more help from, I think, DEQ than we did, Department of Public Health.
Yeah, that was a painstaking process of trying to write rules when you're not a rule maker, but we got those done. But these are the 3 that y'all are responsible for. They are posted on our website. We review them often. But what we have recognized, and this is an undertaking, and Randy and I have been talking about the best way to do it. But the reason I'm bringing this to you today is to not only make you aware and remind you that there's 3 sets of rules y'all are overseers of. We really are going to have to dig into those mobile home park rules that are over 20 years old. They are needed often, particularly when we have our partners in the county with planning and zoning, having issues with mobile homes. They call us and want to know what's in our rules and how can we help. It's always when there's a complaint that they're calling about that. It's either something like solid waste or junk trailers or failing septic systems in the mobile home park. And so when we go and look at the rules, Randy and I, if I'm being honest with you board members, we sort of cringe because we know that we've got some work to do. They're very old and we need to make some modifications to them. That is going to be an undertaking that Randy and I have said we're going to do. And we are going to, in all of our free time that we don't have, but we're really going to work on it. And I wanted to make y'all aware of that. This will be a process. There will be some significant changes. So we'll come to this board for review. And then I believe, and Adam and Ryan, I'm sorry I did not ask you ahead of time, but I believe we might have to go to a public hearing because of the changes that we'll have to have for them because they're going to be that substantial.
Yeah, I think that's correct. I'm actually, as you speak, I'm just scrolling through the public health statutes right now just to see, but we'll have time. I mean, you all are I know it's going to take some time to do some redrafting, and we'll make sure that we're following all of the requirements of statutes when we actually get around to discussing and finalizing and adopting changes.
Yes, sir. And we are, like I said, nowhere close to that, but that is something that Randy and I think we gave a date. What did we say? Do you remember?
You gave me several dates on several of the projects.
I
think this one you pushed out a little further.
We did.
December of this year. So I think we have about a year maybe is what your goal was to have this wrapped up.
To bring to y'all by December so that y'all can look at it. But it is one of those things. When you need them, you want them to look nice. When we give stuff to Adam and Ryan on our behalf and we're trying to, help our partners, we need it to look better than what we've got going on with these rules. So wanted to share that with y'all. The other rules, the rabies rules and the recreational water facilities rules, right now they're in good shape. We don't need any major overhaul or anything like that. We're keeping a close eye on them, but they're meeting our needs as the health department. The mobile home rules just don't. And not everybody has mobile home rules either, but there was a time where we thought about dissolving them and bringing that to the board. And it was brought to us, do we want to dissolve them? But I think the way that I have seen them utilized as the public health director, I'm not sure that we want to dissolve them in this county because when you need them, you really need them. And so I don't think we're there. But there's a lot of changes we can make in there to make them more useful for us. So I just wanted to share that with this board and just remind you the 3 that y'all are overseeing, and to sort of set this as notification that we will be making some significant changes to the mobile home park rules.
May I put y'all on the spot and find out maybe what one big one that stands out for mobile home rule change that that you run into when?
Like an issue?
Yes.
Well, it's
Sorry.
quite, it's a good question. I thought about trying to bring y'all an example. Part of the biggest problem is just the words in there, which me of all people who talk so much, can you believe I would say that? But there's just too many words in a lot of places. And it's like, we really need to trim it down and just like get to the point of what we're trying to say. But Randy, do you remember the one that Lee called us about recently? What?
I deal with a lot of expansion, people wanting to expand parks that were maybe originally set up in the 80s or maybe even 90s. And then they had plans to build in the future. And, now it's 27 years later, whatever that date might be. And they're just now getting around to it. Well, current planning and zoning rules may not allow them to do what they wanted to do when they originally set the park up. And so we run into that a lot. If they didn't plan back then to do it now, they have to meet current rules. And so people are kind of faced with challenges that they can't meet what they're initially wanting to do if they didn't make that clear to us, and we don't have that documentation. And then there's just so many of them. I mean, actively there's 260 plus that we monitor annually and inspect. And then there's lots of them that have kind of fallen off the wayside. But we've ran into a few legal issues dealing with, revocation of the permit and what that looks like. And so there's just some word language I think that needs to be more concise and more clear on how to move forward on certain items.
But as I understand it though, like we're trying to get them off of wells, right? That's been is that in your local rules, or is that?
You don't have to be off of a well, but if you're on a well, we want to sample it.
Yeah.
And so we want to make sure that the people that are there are provided with adequate water as well as sewage disposal. And so that's something that we do is sample the wells. And we don't charge the park owners for that because we want to make sure that, they're providing that for the residents there. And in the past, that's if they couldn't provide adequate water, we would essentially force them to connect to public water. And fortunately, in the county, we have a lot of public water, so there's just very few parks that are wells.
Yep. And then when you've got a wastewater failure there, that's a repair permit that goes through the normal process, or that's more involved. What does that look like?
Well, in a mobile home park, you have the potential for mass failure.
Right.
Because, back then when they were set up, they put multiple homes on one system, essentially. And then so the potential to have a large sewage failure, put them in one place versus spread out. These things are stacked on top of each other. The fire marshal would probably cringe if he was able to do residential because these places are sometimes so close together that, a strong wind and a good fire would take out a lot of the community. The wastewater process is similar, but you're dealing with someone who probably doesn't live there. And so you're dealing with a landlord tenant issue where the tenant is angry that the landlord's not fixing it. A lot of these places are low income. They're scared to say something to the landlord for fear of being removed from the home. A lot of the failures we find on our own inspections, but sometimes they are complaint driven. But it does go through the same process for repairs. The application comes in, we issue a permit. Sometimes forcefully issuing the permit, trying to get the owner to comply.
Yeah. And do you have good records on these, or some of these predate kind of the general record, right? Because we have homes that are so old that we know they have septic systems. We have no records of them. What does that look like with mobile home parks? Are those well documented, or you're kind of finding them out as you go?
The park files are really good considering. I would rather have a napkin with a hand drawing than no drawing at all.
Yep.
So, something's better than nothing. A lot of the parks, I think, I don't know when all this came about, but it seems like the owners would come in, they would bring maps of their parks that were pre-existing, and they would show on those maps where the tanks were, where the wells were, where the homes were located. And so we have all that stuff. I mean, it's some really pretty ancient documentation in my eyes. But it's pretty decent records and, as we've done work in them, we've collected great data too. So there's still a lot of stuff that, we don't have ground penetrating radar and X-ray vision that would help, but and it's like anything else, any other place, people do stuff without permits that we don't know about. So some stuff is kind of just found out as we go. But I think all in all, the records we have are pretty good.
Thank you, Randy. All right, anything else before we move on? That's it. Well, topic we don't like to talk about a whole lot, but then we still have to tackle it. So, mortality.
This is actually good news. The new data shows from 2024 that we have an all-time low infant mortality rate in North Carolina. And it feels like so often in public health, we hear bad news after bad news. We know that the opioid crisis continues in Davidson County, as in all of North Carolina and the country, the world. But this is one of those things that's like, wow, we're doing something right. We're trending in the right way. And the way that we're impacting this locally is through our WIC agency, through our care management team that Crystal supervises, through family planning. If we can stop unintended pregnancies, that is a really great way to improve mortality. It is unfortunate, but sometimes people who don't want to get pregnant don't know they're pregnant for a long time because they weren't planning for a pregnancy. So then they're not getting early prenatal care, and it can create a system of problems. I didn't put this on here because it was one of those things, my news source from it was social media. And while we've already talked about how important social media is in advertising, I wasn't prepared to bring this formally to y'all, but I did see too, which I believe maybe helps contribute to this all-time low of infant mortality. Teen pregnancy rates are also plummeting. The story that I read said that in the last 9 months, more women in their 40s were having babies than women under the age of 18. And so if you think about it, women in their 40s are really planning more than likely to get pregnant, and they're working hard to get pregnant. And so they're getting that early prenatal care that's needed. And that just improves the likelihood of a healthy baby being born and a successful life. So this is really great news. We are so excited to see this. The one caveat and start of this that I would just like to say, while the overall rates have improved, we still see a disparity between minority populations with the loss of life early for their children. And so we'll continue to work in that with public health, but overall, this is really great news. And I'm very proud of the work I know that we're doing in Davidson County to improve lifelong success for infants. So I just wanted to bring that news to you. There's no action or anything on it, but so often I feel like it's doom and gloom with the data, but this is really good data that's trending in the right direction.
Great. Thank you.
You're welcome.
And one of our last topics here is we do have our yearly obligatory, there's the word, training for the Board of Health. And here's a timeline that Lillian made for us of what the topics that we've done since 2021. So you kind of look at that. We are looking for our next topic for 2026. And here's a few ideas that, again, Lillian kind of came up for us. So would you mind maybe giving
I'll be more than happy
break
to.
between each one of those?
Sure. I thought about the things that we've talked about as a board and the kind of questions y'all have asked about things. These topics, I don't have on the top of my mind like the perfect presenter for it, but I thought, these are things that y'all have sort of talked about. So what does public health workforce sustainability look like? And how do we improve the pipeline to getting folks in here? And what can we do as a Board of Health potentially for that? I thought that might be something y'all would like to learn a little bit more about. North Carolina is a decentralized public health system, and I feel like I can repeat that multiple times because of the way it's been told to me at the state. But that really is impactful for the work that we do here. And what I want to maybe for y'all to consider an exploration about is like, yeah, we work for North Carolina. We follow the North Carolina general statutes, but we are local, where we just have the 3 rules that we went over that are Davidson County rules. And there's the Davidson County spin on things because we are decentralized. And I didn't know if y'all wanted to explore that a little bit more. we're all the time talking about general statutes, administrative code and rules. What's the difference? What are the ways that people can appeal rules and things like that? I know we have several lawyers in the room, but not everybody's a lawyer. So what does it look like when we're talking about different rules and laws and general statutes on how we're implementing that locally and what appeals process people have for those? And then this other one, I just thought we spend a lot of time on public records requests, and the county has set up a system because when the Freedom of Information Act came around and many people started asking for records, you know, the county was like, we've got to find a way to manage this. So they created a document online that if you wanted a piece of public information, you had to put in the request. And then if it was something that was going to take hours and years to get together the information, the county could charge you a minimal amount, but that's why they really put that system in place. Before that was ever put in place, we had the same type system for our septic records. They are not the same. They don't fall under the same Freedom of the Information Act because we're the keeper of those records and they are available for anyone who wants them. So that's different from those, the records that apply to freedom of information. And then there's the HIPAA protected records that people will try to ask for in there too. And so I didn't know if y'all wanted to talk about what sort of records we have here, which fall into which category and how we share them out. And then I just thought, you know, maybe somebody has a burning desire that y'all want me to look into for something else. So Chairman, I'm asking you today to maybe throw this out there and maybe at our next meeting, we can whittle it down a little bit more and get some more details. And then y'all can choose the topic that you would like.
I'd like to ask one question now. Back on the very first one, workforce sustainability, we're talking about our workforce.
Public health.
Our
Davidson County
Davidson
Public
County.
Health. Yes, sir.
All right. Well, then I'd like to say this, whenever, you know, I'm an Army guy, so whenever you're kind of going after the enemy, you always bring this phrase up about center of gravity, you know, the center of, and I can't imagine anything that's more important. And we've got great staff, leadership here. But we can always maybe do better at recruitment and retention of the good staff that we have. So I'd like to, you know, see if anybody had any agreements with that about workforce. And I love all the other topics too. I love the legal side of it, the public records, being an optometrist and provider myself. You know, I've got we go into that too. But I don't know specifically topics for the workforce sustainability, but I think that's because I think we'll probably one day need that education, you know, to be able to keep our talented staff that we've got now and to recruit more. So that's just my 2 cents worth I wanted to throw out there with workforce sustainability. Anyone else specifically got one that you just wanted to know? Justin, I know you're dying to do something on legal, right?
No, absolutely not on legal. I feel like we've talked about workforce sustainability every meeting for the last 4 years, right? And I don't really want to spend any more time talking about how we're underfunded and we don't pay our people enough. So to me, that seems like a boring topic. I actually kind of like the decentralized public health system topic, which maybe only the lawyers would find that interesting, but it would give us exposure into what other departments are doing potentially, which could give us ideas, which might even feed into your workforce sustainability approach. So I don't want to talk about workforce sustainability because I think we all know what are here. They've not been discussed and they're not hidden and there's no secret sauce there. It's simply a market driven condition for that.
Any other specific, Dr. King?
Yeah, being the newest member on the board, I think I was most interested in the decentralized public health system training. Just that seems quite unique. I think, Lillian, you said the way other public health systems work, you have the state, and then they just kind of trickle down to the local county health departments. Where I was from in Massachusetts, that's basically the way they did it since they dissolved county government, and then 5 out of the 8 counties were kind of a small state. So yeah, I used to be very interested in just learning more about that, and I guess different, efficiencies that we could learn from other other counties and, kind of like Justin was saying, with our limited resources, we need to figure out how we can do the best we can with what we have.
I can go back and I think you were not here for the last year's presentation, right? So I have the PowerPoint that I presented last year about the sort of the basics of the health department. So I'll make sure you get a copy, or maybe you have a copy.
We do. We can make sure to get that to it.
Appreciate it.
So, Dr. King.
Any new topics besides the 4 up there that they can come off the top of their head with? I think those 4 covered just about as many things that we really need to, for sure.
We don't want to talk about phones at swimming pools, which I didn't realize was a requirement.
Yeah.
I didn't know. That's why I brought it up.
Yes.
They have to be rotary phones, like.
At this point, you would think
Yeah.
to have a cord on it is like mind blowing to everybody.
Right.
What is a portable phone available, or it has to actually be the old school phone?
It has to have a cord just so, because if it's not, it dies. So that's what happens. People
Yeah.
leave it off, it'll die.
Yeah.
It's just to absolutely have a phone that they can call 911 if something's wrong.
What is it? You pick it up and it auto dials?
Some of them, there's like bots, some of them you can match that they have companies, some auto dials, and some you actually have to dial 911.
I'm sure kids don't pick them up. But
Well, I mean, I'm sure everybody's probably gonna grab their cell phone first, and not use that, but it's, who knows, people leave their phones at home, we can't always assume that they'll have one. And the rules were also made, in the 90s, so.
It's hard to be the corded phone, but you don't have to worry about a battery dying. So.
Yeah.
True.
I mean, even your internet phones now require power, right, to actually operate. So I didn't know that they still had, phone cords. Like, I didn't know that was a thing. But apparently it still is.
About $10 at Dollar General, when people have to run and go grab the
Yeah.
cord phones. They do make them currently.
For the decentralized public health system, we're not unique, are we? In the county.
North Carolina is somewhat unique in the United States, but no, all the counties are decentralized. It's just when it's really interesting, and if this is the way we want to go, I'm already like sort of thinking about who would be the best person to come and talk about this. But when it got really interesting to me was when we locally have requested support from the state on things like, we're decentralized, we can't help you with that. But when we want to do something different, they're like, oh no, we're the state, we tell you how to do this. And so, there's that old saying, what's good for the goose is good for the gander. It doesn't necessarily always apply in this decentralized system. The state seems to want to kind of take their hands off on some things, and then other times they want to be like, over you, we are the state. So I thought that would be interesting for this board to sort of just understand like how that relationship is, what the rules and how they are applied that way. So I was thinking, somebody from like the state perspective, maybe talking about it when we bring it to you, but I can put together some different track options for y'all to look at if that's what y'all would like to do.
And this is by what date do we use it?
We have to do it by the December,
Okay, so it's just end of year. We
Yes,
usually
sir.
we usually complete it by fall.
September, I think is the meeting.
Okay, usually. We don't have to decide specifically on the topic, but it seems like, I'm the only person that likes the staff and stuff, so. No, I'm
We'll
just
remember that.
kidding. No, I'm just kidding. It is true. I agree with Justin. We do have talked about that a lot. And other than that one that I brought up, I think I'm on board with knowing more about that. But again, we don't have to make the topic set today.
No.
But it seems like that there's no new ideas right now, and the other two, wasn't too long ago, we did some, I think, statute information, right?
Go back.
Yeah. It might have been 2021.
Perhaps.
Yeah.
The 2021 Mike Newby did, that was a
Yeah, I
long time
remember.
ago.
So I really enjoyed that one, but yeah, do we want to move forward and at least narrow it down to a topic, board members? Okay, yeah.
Well, then if we want to choose that today, do you mind getting a motion for that? And then I will, so that way for accreditation, we'll have that earmark that we got a motion that that's what you want to do, but the next meeting I'll bring to y'all, maybe like, this is option number one, this is option number two, which way would you like the training to go? And we could go from there.
Okay, yeah. Yeah, I didn't know if we needed to, if we need a motion to pick the topic.
Yeah, we do.
Okay, then, yeah, let's put it out there. I guess the motion is that our training, for calendar year 2026, is going to be, North Carolina as a decentralized public health system. Do I have a motion? Okay, thank you. And a second.
Second.
Kester, all in favor?
Aye.
Any opposed? All right, sounds good. Then we have that taken care of, and we will be able to get some more information about the bigger specific, specific or channelized topics on that next. Well, awesome. Well, we have any other discussion of just in general? Our next meeting will be August 4th. More information to come with that, but we'll need a motion to adjourn. And a second. And a second. Right? All in favor? All right. Any opposed? All right. Thank you very much.
Thank you.
Called Joe yesterday. He's
And what did we say?